Yeah, opened up. Yeah, please join. Yes, started. The session is now open. So, shall we start? We'll just wait for a couple of minutes to join, to let all the other speakers join. And then, Puru, I'll give you a heads up to start.
Sure, Puneet.
Thank you. Puru, let's start.
Yeah, very good evening. This is Purushottam. Very good evening. This is Purushottam Kaushik. I would like to welcome all the speakers and all the participants to this webinar on behalf of World Economic Forum and also Smart City Mission, who is co-hosting this webinar. Now, I would rather give you a background of what I think World Economic Forum, most of you would be knowing. We are a public-private corporation. We focus on global concern issues. And specifically in this background, we are looking at how India's smart cities have actually brought themselves to the best in facing the COVID and providing COVID response. And that's what we are going to discuss today. Within World Economic Forum in India, we have the Center for Fourth Industrial Revolution. which is focusing on all the emerging technologies, AI, IoT, blockchain, drones, and data policy. And we work very closely with Smart City Mission on various initiatives. Now, today, what we would like to, I would like to introduce my co-host, Kunal Kumar, who can welcome all the speakers as well as the participants for the webinar.
Thank you, and thank you to the World Economic Forum and the Center for Fourth Industrial Revolution for making this webinar possible. These are strange times. I'm reminded of John Lennon's lyrics. Life is what happens to you when you're busy making other plans. And how much more true that can be in the current context, right? However, when the going gets tough, the tough get going. And we have some really tough guys with us on this session tonight. So I think it promises to be a great session. Back to you, Puru. I think you can hand over to the moderator. He can formally introduce all the panelists.
Thank you. Thank you, Kunal. And I would like to kind of mention is that we had more than 500 registrations, people also joining in from Facebook Live. Again, welcome you all. Good evening and good morning also people who are joining maybe possibly from US and different parts of the world. I would now like to introduce Dr. Amin. He is the Global Director of the Data Lab at World Resources Institute. And also Dr. Amin was Chief Analytics Officer for the City of New York and the Director of Mayor's Office of Data Analytics. He ran the Civic Intelligence Center, and that allowed one of the largest cities in the world to aggregate and analyze data from across agencies. So as Kunal mentioned, the biggest highlight of this whole COVID response, and especially the India Smart City mission, has been the leverage of technologies. So let's see how possibly the best came out in India's Smart City mission. So over to Dr. Amin.
Thank you very much. Really appreciate the introduction, and I'm excited to be a part of this conversation. As you both just mentioned, these are really important and interesting times, and we're looking forward to hearing from these very important and interesting leaders how they are dealing with these times. And so what I first wanted to do was give the audience a sense of the flow. We have many esteemed panelists, and the key here was to ensure that they were able to be very helpful and thoughtful in their conversation. And so the way we set up the flow is that I will first introduce each panelist and then ask a question that each panelist gets to answer. And each panelist will get about 4 minutes each question. And we have 3 questions that we're going to go through. So, and then we hope that the participants online are listening to those responses and sharing questions. And we'll have some time after each panelist has had an opportunity to answer questions that I pose to them as the moderator to begin to do a Q&A with the audience as well. So please submit your questions online. And we look forward to sharing some of those questions with the panelists. So with no longer further ado, I'd like to first formally introduce the esteemed panelists for this session. Ms. Sharda Muralidharan, she's the IAS Principal Secretary, Local Self-Government in the State Government of Kerala. Representing the State Government of Odisha, Mr. Mati Vatanan, the IAS Principal Secretary of Housing and Urban Department. City of Chandigarh, Mr. Kamal Yadav, the IAS Municipal Commissioner. And lastly, but not least, from the City of Surat, Mr. Banchanidhi Pani, the IAS Municipal Commissioner. Welcome everyone to this panel. And so I'd like to start this off by saying that we asked and engaged the panelists to really share, as they begin to answer these questions, to share their thoughts around these responses and focus those thoughts around how they've been innovative as well as been inclusive in solving some of these tough challenges that have popped up due to the COVID-19 situation. So I'll start with Nisharda from Kerala. The first question is, can you share 2 or 3 unique actions that you took with agility in the COVID response, including one where you work with communities, private sector, and innovators, to fill the gaps? What were factors that allowed for you to move quickly?
Okay. Thank you, Dr. Amin. Kerala was the first state to be hit by COVID in India. And this was as way back as in the end of January. And we have already had 2 waves of COVID. The first one was contained, and the second one, hopefully, is being contained. And while we did this, there were 2 experiences that we would really like to put out there, which helped determine the way we responded. One was, and both of these happened in 2018, when Kerala was hit by, first of all, the Nipah virus, which had a horrible fatality rate. And we were completely taken aback and unaware of what to do. And followed by the floods of a century for Kerala, when more than half of Kerala went underwater. So both of these actually shaped our response to how we dealt with COVID. The first, what Nipah taught us was how to do tracking, surveillance, community surveillance from start to finish. Protocols, very robust protocols had been developed out of Nipah, and that we put into practice from the word go in Kerala. What the floods did was, by way of disaster resilience, helped us particularly to get the community in readiness in anticipation. We'd actually come out with community-led disaster management plans. And this was, of course, not knowing that COVID was in the offing, but therefore these plans helped us a lot in bringing communities on board. So to say exactly what community-led surveillance was, I talked about the 2 waves. The thing is, we noticed that we were getting, it was people who were coming from abroad who were carrying the virus with them. So we did an almost 100% surveillance of everybody who came from abroad. We looked at the passenger manifest, we talked to the immigration, the Bureau of Immigration, put together the data sets, and on that basis identified 30,000 people. There were about 150 cases, but we had 300,000 people who were under surveillance. The route maps, where they went, when they went, who they interacted with, the places they stopped by, all this was available to the public. So public came forward and said that, look, we were there around that time. And that helped us to identify and put people in under surveillance. When you talk about communities, we've got a very strong local governance structure, which goes all the way up to the tiny little wards, where you have health workers, community women, and resource persons who came together. They did house-to-house surveillance. They gave support. They gave food. They helped with medicine. They even helped, in cases, help the tensions of people, because they, oh, my pet dog has, needs to be fed. Can you look after him? So we would do those kind of things as well. So there was very granular response and support which was given to the communities. And this I would think would be something which was very critical to how we did things. The fact that we had a community response plan and engagement also meant that we mapped all our vulnerable communities. So when we did surveillance, it was not just about identifying people and tracking whether they were developing symptoms or not, but it was also looking at the people in the household. Did they have comorbidities? Was there anybody else who was at high risk? Were there senior citizens? How about people in the neighborhood? And that's been something that we've been tracking, analyzing the data, and on that basis doing so. While our testing has not been great in numbers, it was good at the start, but it's been very focused. But we've been looking completely at high risk populations in doing our testings. So this would be something that I would like to share. Thanks.
Excellent. Thank you very much for that. I really appreciated the context around learning from past responses, learning from past situations, and then also very intrigued, especially from my time in New York City, how you guys were thinking about mapping the vulnerable and understanding your population so that you can better target. So next, Mr. Mati, can you please share some insights around that question for City of Odisha?
As Odisha is highly vulnerable to natural disasters, especially the cyclone, the state has built over the last several years a strong emergency response system. And the state machinery is actually well trained in handling emergency situations. Our state cabinet, even before we got the first positive case in the state, as early as March 13th, met and declared COVID-19 as a state disaster, the first state to do that, whereby the Disaster Management Act has been invoked. A number of crucial decisions were made. Some of them are, constituting an empowered group of ministers headed by Honorable Chief Minister to take decisions with all the powers of the cabinet delegated to ensure decision making. A committee of secretaries have been formed with the chief secretary at the head. Cabinet also has sanctioned the 200 to face the COVID situation. There was no budget provision in the state budget. It was not anticipated. So this money, this timely sanction of the supplies, and we set up the COVID hospitals. We were the first one to set up large-scale COVID hospitals. Not only that, many people-centric measures were also taken in time. Advance salary for 3 months released for all the health functionaries in the state. Advance payment of 3 months monthly pensions under the various social security schemes like the old age pension, widow pension, all have been released in advance. 3 months quota of ration items, food grains for the people to the public distribution system card holders were issued in advance, along with paying 100,000 rupees for each card holder. Yeah. Also, to take care of the people in distress, we have started the feeding program in the urban areas in partnership with the NGOs, women's self-help groups. We already have an ongoing affordable meal program. It's called the AHAR program, run in the urban centers. It is run with a partnership with the NGOs and self-help groups. It was not difficult for us, to rope them in utilizing the available infrastructure and the human resources available to scale up the feeding activities immediately in all the urban areas. State also has focused on the animals' welfare, especially the stray and street animals like dogs, bulls, monkeys, etc., which are normally fed with the leftovers from the hotels, restaurants, and the eateries. Due to the lockdown and closure of the eateries, they were actually going hungry. State has come out immediately with an animal feeding program in all the urban areas in partnership with the NGOs and the local community-based organizations who are normally working with in the urban animal care sector, and we immediately started the feeding program for them. These are some of the activities we have taken in time that has actually put us in the right pedestal.
Thank you very much. Another great example of being targeted in terms of your response and looking at the whole community. So absolutely appreciate that perspective. And so now, Mr. Yadav from Chandakar, can you also add to this discussion?
Good evening, everyone. Thanks for inviting us. I will give the perspective from the side of a city administrator. Chandigarh is a beautiful city and it's a capital of two states of Punjab and Haryana of India, a union territory in itself. So we are having a unique system here, but when this COVID-19 struck us and we went for the lockdown in the city, so we immediately put in place a system for providing essential supplies at door to door. So we, since public transport was suspended, so we used our public transport buses along with our registered street vendors who actually left with no employment due to lockdown. So we engaged both of them and delivered essential supplies door to door. Then, since the COVID care centers were required, so we are having our own community centers which are used for social gatherings. We converted those community centers in COVID care centers and also use them as migrant shelters also, because a lot of strained migrant population was there, and we utilized these buildings for that purpose. Third thing which we did was our integrated control and command system, which is one of the good initiative taken up by smart cities. So we activated our integrated control and command system and rebuilt it with the demand of COVID-19 situation. And we tracked all our essential supplies through our integrated control and command system. We utilize this for all the data generation, creating heat maps, and then creating actual hotspots within the city, so that we get the real-time detailing of all the things. Then further, we created the sector response teams, because Chandigarh is divided in around 56 sectors. So sector response teams, we took our own employees along with the volunteers from the community, and those volunteers and our own teams, they stationed themselves in sectors. They provided help to all the needy, may it be senior citizens, single women, and other things. So they actually worked as a helping hand to the community. Further, we engaged we are having in Chandigarh lot of institutions, and we are having a platform of CRIC, which is actually a combined body of around 30 institutions. So we gave our problem statements to these institutions and got the answers and solutions from them. And a lot of new solutions made with a e-pass generation system or monitoring of our own things. We actually utilized these institutions for helping the city when it is needed for the most. So these are certain things which we did in the city, and we are trying our best to manage situations here in city, and hopefully we all will come out of this situation. Thank you.
Thank you. Thank you so much. And lastly, for this particular question, and I just want to remind the audience the question, can you share 2 or 3 unique actions that you took with agility in the COVID response, and specifically around how you used innovation and inclusivity in your response? So thank you, Mr. Kumar, for that. And so now going to, from the city of Surat, Mr. Pani, can you share some insights as well?
Thank you very much, Dr. Amin. In fact, Surat is one city which is the economic hub of Gujarat and also India. In fact, the moment that was on 17th of March, when we spotted the first case of COVID-19, immediately within 48 hours, we created SMC COVID application, and we started to track all the foreign travelers. In fact, all the 4,006 foreign travelers from 97 countries were tracked through this SMC COVID-19 tracker. And their location was monitored, their home quarantine was monitored through this application. And second, their medical condition as to they used to give the morning as well as evening parameters, their health parameters was being reported. And there was a selfie also attached to the medical condition. So apart from their home quarantine, we also monitored their health condition both in the morning and evening. In fact, that started our tracking and testing and treatment strategy. The strategy that we took was triple T IQ strategy, that is tracking, testing, treatment, and isolation and quarantine. As a part of that, this SMC COVID-19 tracker helped us to find out which are the clusters where we are finding more acute respiratory infections. And These are the clusters in which we started concentrating, and we started concentrating of these cases, and we found that there are some hotspots emerging. So the identification of hotspots, early identification of hotspots, and their monitoring was done through this SMC COVID-19 tracker application. That helped us to create clusters and contain these clusters. And in fact, from this SMC COVID-19 tracker application, we have been able to create 27 clusters of close to 7 lakh people who are in fact contained and isolated, so that we can fight effectively COVID-19. That is one technology application that we have made. And in fact, we are monitoring this application through our war room, which is created through the Smart Cities mission of Government of India. In fact, we are monitoring every minute from the Smart City Center, that is Integrated Command and Control Center. And the information sharing is seamless between police, municipal corporation and collector. So that information is making all of us work in a coordinated and integrated approach to fight this COVID-19. So the problem of coordination is completely eliminated through this application also, and our command and control center. That is one. Second is you asked me how to make things inclusive. In fact, the food distribution center is something that is very unique to Surat, because we have more than 12 to 15 lakhs of migrant population. When the lockdown was announced, this migrant population was here stranded. So we have to find out food distribution centers. We created more than 140 food distribution centers, and you would be surprised that 30,000 women of the city contributed by creating rotis of 1.2 million rotis are being made every day, which is being supplied to the stranded laborers in different camps. And this is something which is very, very unique. Another very unique thing about Surat is that, our self-help groups have created masks for the people to wear, particularly the deprived sections in the cluster areas. And they have made so far 6 lakhs of masks. And some of the masks also they have sold, and they have earned more than 2.4 million of rupees from that. Apart from that, I would also highlight one very unique thing, that we have created a isolation and the COVID health center facility out of a multi-level parking facility. This is a 4-story multi-level parking facility having 2 lakh square feet area, because for future preparedness, because disasters don't let us know when they are coming. So we prepared this multi-level parking into an isolation and COVID-19 health center immediately within a matter of 10 days, and 548 beds. This is one of the biggest COVID-19 isolation centers in South Gujarat. And that gave us enough confidence that we can surely find a way out of the limited infrastructure that we have. In fact, this Surat Cares thing, how women are contributing, how women are facilitating creation of masks is very touching for the city of Surat and in its fight against COVID-19.
Thank you very much. I thought that that conversation that all of the panelists shared, specifically around the technology and innovation that they're bringing to bear, but then also how you're using it to target areas and places and individuals, vulnerable and otherwise, in order to provide services and capability, which is one of the key tenets of a smart city that's not reactive but proactive and innovative. And so those were great examples of how you're moving the needle there. The next question I want to ask all of the panelists is around, you talked about what you were able to bring to the table. I wonder if you could share some insight into things you wish you had in place or still need in place so that you can respond to the crisis better. And then, of course, it'd be great to understand any barriers or data gaps that are keeping you from making some decisions quickly. So we know there are good things that are being done. What are some things that can be improved upon, and some things that you can bring to bear to help you move more quickly and more efficiently? So again, we'll start with Ms. Sharda from Kerala.
Right. Yeah, I have a couple of things that I'd like to say in this context. One is, of course, the fact that we were throwing up humongous data. For us, the challenge was also generating the data was easy. Getting the apps to do it was also not a big problem. But who was going to sift through all of that and come up with, give us information that was critical and needed at that point of time? We had to, put together a motley crowd of people from, we pulled them out of various organizations and support programs and put them in. We did also set up a data center, but then there's just too much to handle. And there was this question too, for the department, which was doing so much of work with regard to, from the one hand, you were looking at vulnerable communities, you were looking at how, where the morbidities were lying, you were looking at who was getting food, we were looking at who was starving and who was not. We were looking at people who were getting impoverished because of the lockdown. You were handling problems of unrest, the guest labor camps, all of this. So each of these were multiple data sets, multiple information coming in. We needed also to look at our infrastructure and readiness and how exactly, we bought time with the lockdown. So what exactly was our readiness if this was, Kerala is peri-urban throughout. So if it was going to spread out of the cities into the villages, which it has, how do you deal with it? You don't have that kind of infrastructure there. So these questions were on one side. Another question, which keeps bothering me, of course, is that yes, in times of crisis, we get our act together, we get crisis management groups, we set up war rooms, we have emergency response teams, all of that. But all of us are walking a tightrope. You need to take a quick decision, but a quick decision means that you are bypassing procedures. And these procedures are there for a reason. What happens? What are the procedures you bypass? What's the protocol for bypassing them? What can you do? What can you not? What is the balance that you come up with between risk perception and quick action on the one hand, and accountability and appropriate response on the other? Because very often you find later in the day that maybe your response was inappropriate to the occasion. But that's the benefit of hindsight. And how do you know that that response was bona fide or not? These are things that administrators like us face all the time. Later in the day, there'll be questions asked. And I so wish that there was a protocol in place which would help me answer them.
Protocols, excellent. Thank you so much, Ms. Sharda. So now on to Mr. Mati. Can you share with us some thoughts on things that you would like to have in place, or conversely, any things that there are gaps, that data gaps or technology gaps that you would like to have as well? And I just want to remind all of the panelists, the last question was 4 minutes. This one, we're giving about 2 minutes for your response.
Thank you, Dr. Raman. So we have been thinking through all the various types of informal workers, especially in the urban areas, who are not able to earn their livelihoods during this lockdown period, who would be otherwise requiring the state's support. We could cover the informal sector, like construction workers, as they are all identified and registered with, they were all provided with one-time financial assistance. We could cover the street vendors, roadside vendors, as they were also been surveyed, identified, registered under the street vendor scheme. All the street vendors were provided with a financial assistance through the direct benefit transfer.
Yep.
But one more deserving category of informal workers we found is the cycle rickshaw pullers, who are present in all the urban areas. They are important, in the transport delivery system, for whom there is no scheme available presently. Their livelihood is seriously affected due to the lockdown. Though we wanted to reach out to them with some financial support, we couldn't reach out and succeed, as we faced two major constraints. One is that they were not surveyed, not yet identified, and fresh survey and identification during this lockdown period will be extremely difficult. Second, many of the cycle rickshaw pullers do not own the cycle rickshaw. Someone else is the owner, and the rickshaw puller hire them for rentals either on daily basis or on weekly basis. So in that case, it will be extremely difficult for the administration to ensure that the benefit actually reaches the rickshaw puller and not the owner by mistake. So hence, we could not actually move forward and bring out a scheme. We regret that we could not help them out.
Thank you so much, Mr. Mati. And now we're going to move to Chandigarh with Mr. Yadav.
So basically, what I feel I could have done it better is the technological solution, because normally in a city like Chandigarh, we are prepared for some man-made disasters like fire, maybe we don't have any flood issue, no earthquake prone area and other things. So technically we are very less prepared for any type of disaster. And thinking of any disaster like pandemic of COVID-19 in 21st century, it was, I think, none of the administrator or even the professionals or health professionals ever thought about it. So this is actually giving a new perspective to us as city administrators also, that there are a lot of things for which we should foresee, and we should prepare ourselves in a better way. The second thing is where I would love to have better control is my administrative jurisdiction, because my city is actually the state capital of two other cities, two other states of India, and somehow the administrative control on those governments is not that much, which as a simple city administrator I could have done better. So from my side, I think these two are the major thoughts for future or to be taken.
Excellent. Thank you. Thank you so much, Mr. Yadav. And so now, lastly, on this question around something that you wish you had in place, I'd like to ask Mr. Pani to answer the question. But then also, can you talk about anything that you may have brought to bear, you know, in terms of taking quick governance actions to unlock any new innovations? You know, a good example is accelerating procurement, standing up a dashboard. So where you have found gaps, and any examples of where you've sort of taken quick government action.
No, in fact, if you see Surat, then fortunately, because of smart cities, there is no gap as such regarding technology and technology related issues. But one thing which I found one gap was the migrant population. See, Surat, as I told earlier, is an economic hub, and lots of migrant population, they live here. In fact, more than 2 million migrant population from 12 states of the country, they live here in this city. In fact, initially in the year 2000, there were around 20% of Surat's population which was completely living in slums. We have been able to reduce it, fortunately, because of Prime Minister's public housing scheme. And it has been reduced up to now 6%. Earlier, which was 20%, people were living in slums. Now it is 6%. But the challenge remains. And in this COVID-19 pandemic, one of the most important thing how the contagion spreads is through high density areas. In fact, Surat is one of the highest possible density areas in the world. In 1 kilometer areas, there are as many as 1 lakh people. In fact, that speaks for itself how the contagion can spread very fast. So one area which I thought we could have, that is a completely zero slum city. In fact, the priority remains and the priority will remain that Surat will completely be a slum-free city, and 6% of the population, close to around 40,000 houses will be built in a war footing manner in the days to come. This is one issue that we wish it could have been there.
Thank you. Thank you very much, all the panelists, for answering that question. So lastly, sort of we've been walking down this road in terms of what are some of the solutions you're bringing to bear. Then we talked to you about some gaps, some things that you wish you had in order to better respond to this. And so keeping in, sort of this flow, the next question is around sustainability, right? And, can you, so with that in mind, can you share one thing that you're doing or would like to do that will help build long-term systemic resilience for the people that you're serving? Again, if you can share an example, both infrastructure-wise, possibly process-wise, or possibly technology-wise, that you're bringing to bear for sustainable response and capability after we successfully move past, this particular COVID-19 challenge. So again, we're going to start with Ms. Sharda from Kerala.
Thank you. So when you look at what we are doing that we hope will help us and perhaps also others in the future, is the work on the community-led disaster plans, disaster management plans that we have come out with. They originated before COVID in response to the state's experience of repeated disasters. But what this does and what is inside this plan, for one, it actually takes out of the lived experience of people. So there is ownership in terms of what to do and how to do it. There is also, by going through that process of community engagement and discussion, doing transect walks, etc., also looking at the various maps that we put together for the community, for every local government. We've got about 1,000 local governments, and each of these 1,000 local governments now has a community disaster management plan. So, and each of them has about 27 data sets of maps, which have become layered and which we hope to take forward in terms of understanding what response to what kind of calamity needs to be taken. So the important thing also there is that there's the understanding of, there is an organic understanding of the need for readiness, as well as the need for information. How data and putting data together and using it as a repository is something which enables quick action. Yeah. So that's something that we have, that we've learned. And, we had created emergency response teams. We had done a complete infrastructure and human resource inventory. And all of that stood us in good stead when we were looking at how do you respond to a pandemic like this, particularly in times of complete shutdown. We had information on vulnerable populations. So what I would say is that it is extremely critical to invest in disaster resilience of communities.
Excellent. Thank you. Thank you. I think that's a very cogent and key point. Mr. Mati?
Yeah. We are aware that COVID is not only a health crisis, but also is an economic crisis, affecting seriously the livelihoods of thousands of people, especially the vulnerable urban poor and the marginalized people. Even after the current lockdown is lifted, the normalcy is not going to return immediately. We are aware of that. It will take considerable time for the economy, especially the informal sector, to revive and come back to normal, so that it can provide employment to thousands of workers dependent on the informal sector. Yeah. Hence, we thought it necessary and prudent to come up with a new scheme urgently to provide wage employment to the urban needy people in the urban areas. Unlike the Manrega scheme, an employment generation scheme in the rural India, we do not have an urban counterpart scheme in India. So we thought that we need to come up with a new scheme. So we have come up with a new scheme within 3 weeks of beginning of this crisis. It's called Urban Wage Employment Initiative with an initial outlay of 100 crores of rupees. It has two objectives. One is to provide wage employment opportunities for the workers, especially in the informal sector and the other needy people. Second, to create community assets, that is the public parks, playgrounds, community centers, self-help group work centers, rainwater harvesting structures, stormwater drainage channels, taking up plantations, etc. So one of the highlights of this new scheme is that there are no contractors involved in this scheme. All the works would be implemented through the community-based institutions, that is the women self-help groups and their federations, and the slum dweller association in the slum areas. We have a Jaga Mission program, the land rights program we have. So wherein, more than 100,000 land rights have been given to slum dwellers on in situ basis. And we have mobilized the community into slum dweller associations. So they are now vibrant institutions. So we thought that instead of engaging contractors and implementing these schemes, we should implement these schemes through our community-based institutions like self-help groups and the slum dweller associations. So we have roped in them as our implementing partners in this program. It's truly a community-led development program, which is going to help in building a long-term systemic resilience for the marginal workers in the urban areas.
Thank you so much, Mr. Mati. Mr. Yadav, anything with respects to the city of Chandigarh, how you're thinking about sustainability and resilience?
Sustainability, one thing we are seeing in this lockdown period is that ecologically and environmentally we are improving. The city parameters of pollution and other things have actually improved. A lot of issues which we usually were facing, like traffic and other things, those have been actually, now we are feeling that that has been taken care of. But obviously this is an artificial solution of the problem. So now as a city, we are working on this thing, that how this ecological or environmental benefits can become more sustainable in times to come by providing more non-motorized transportation, switching public to the better mode of on less polluting system, so that we can actually retain this environmental benefits which we have reaped during this time. And second thing which I would like to maintain in future is the trust which we have earned from public, that no, governments are not actually when the time comes and it's true that governments can work more efficiently in a very effective way. So we would like to keep that pace post-COVID also, or post-lockdown also, so that the trust which has been created between citizens and the city institutions, that can sustain longer. Thank you.
Thank you very much. Thank you very much. I appreciate you sharing this conversation around trust. And lastly, Mr. Pani.
Thank you. In fact, in Surat, SMC COVID application has made us actually fight this pandemic in a better fashion. This technology will be used and it can be accelerated in future for disaster management purpose also. For example, Surat is prone to floods, Surat is prone to cyclones, Surat is prone to different chemical disasters also. So this application that we have created to fight pandemic COVID-19 can be used for future disasters also as a matter of resilience. In fact, this application has taught us how to identify the red, the hotspots, the orange, the danger areas and the green zones. In fact, this is how we can make, for each disaster, we can create different layers, and that will be used in future. Also, along with this application, we will create a better engagement with the community. For example, the way the NGOs, the communities, the self-help groups, and the women's group have come up during this kind of crisis to help us, that needs to be sustained on a long-term basis. And this will, because Surat, we found that their contribution for these food distribution centers or masks, and this has been tremendous. So we want to create a long-term relationship by making a charitable trust involving all the self-help groups, women's groups, and NGOs, which will cater to the community engagement during times of crisis and during normal times as well. So I think these two things we want to create for future, so that we can fight future disasters much better.
Thank you very much, and I really appreciate the conversation. This was really a very thoughtful conversation around how consistent, thorough, and really, quite frankly, steady the voice of government in India has been in your respective cities and the role you're playing. Government plays a key role in providing services, but also providing a blanket of security and trust, as was mentioned, with residents. And so this conversation was really sharing the end-to-end concepts that you all are bringing to bear. And that's been very helpful. So I really appreciate you sharing that. What I want to do is open it up for questions from the community at large. We have a lot of participants. And so I'm going to ask each panelist a specific question that was shared from the community, the participants that were listening in. So let's start with Principal Secretary Mati. With the cyclone season coming, if the state has to evacuate 1 million people like last year, how will it do so while maintaining physical distance and ensuring it does not trigger a round 2 spread?
So every year, we remain prepared whenever, the monsoon is nearing for a possible cyclone. We remain in the state of alertness. So this year, since the COVID is on, the additional burden would be to maintain the social distancing and to have other restrictions. So over a period of time, thanks to the government's housing programs, lots of houses have come up in the coastal areas, unlike the earlier years where people used to live in, temporary structures with other than RCC roofing. Now with the Pradhan Mantri Awas Yojana and our own state schemes, millions of houses for the rural and urban poor have been taken up.
Yeah.
There may not be much requirement of moving people, only for the purpose of the, wherever there is a possibility of flooding, we may have to move them to, higher places. Otherwise, the requirement also will substantially come down, because most of the houses have become Pakka houses for the permanent structures. And in addition to that, we have lots of cyclone shelters constructed on the coastal areas. We have public institutions with good buildings. So we may have to increase the number of buildings to be identified as cyclone shelters. Of course, we may have to maintain the social distancing, all those things. And we would be able to, I'm sure we will be able to handle that.
Thank you. Thank you very much for your response. The next question is going to go to Secretary Sharda. How will your local government now start maintaining records of migrants and informal economy going forward? What are you going to do now to ensure that all informal work is collectivized, surveyed, and registered?
Right. So we have a population of close to around 400,000 migrant labor. We, interestingly, in the state, we call them guest workers. So what has been done by virtue of the lockdown and the fact that they are all in camps and identified locations is that we have done some assessment. We've taken details of individuals, where they come from, what their skill sets are, the area that they're working in, and also we've also been tracking their health conditions. So from there to registration, we've not yet looked at registration yet, but from there to registration, we've got the database. And now it's about bringing that database into a formal application where we could look at taking this further on. So we've also started, particularly from the angle of people who are dying to go back and are unable to, and are suffering from lack of employment and lack of money coming in. We've also been looking at what are the kind of areas and what is the work that we could get them involved in again, now that work is slowly starting to open out. So we've done that. We've also looked at skilling programs that we can get them into. So there is actually a plan of action that is being developed in the state.
Excellent. Thank you. Thank you very much. So for Commissioner Yadav, Chandigarh is unique in that it is the capital of 2 states. Thus, it has 2 CMs and 2 secretariats. In times of crises like this, when decisions need to be made quickly and enforced, coordination with 2 state governments becomes difficult. Can you share your experience navigating this?
Yes, the best part is that in Chandigarh, the governor of Punjab, which is one of the state, he is our administrator. Okay. So the best thing which started here, or to tackle this thing of coordination, we created one war room, and their governor and administrator of Chandigarh, he is taking daily meeting and having the officers from Punjab and Haryana government also on video conference. So whatever state boundary disputes and who all are to be allowed to come inside, and all other type of issues that patients are coming without screening and other things, those are being sorted out there on the daily basis. And all health professionals, team of the health professionals that is supporting that. And this is actually the mechanism is working well. And that's how we are able to coordinate between 2 states and this Union Territory of Chandigarh.
Excellent. Thank you. Thank you very much for sharing that. And lastly, for this panel and this discussion, Commissioner Pani, how are you ensuring data that you collect is encrypted, and how will it be stored / managed? You're collecting live data through the COVID-19 tracker for better response. However, how are you making critical information available to citizens in real time, like number of beds, food kitchen nearby, etc.?
In fact, the first question regarding the data security, in fact, the data is secured through the Microsoft SQL server. And there is an OTP based system which we keep the data private and secure. That is number one. Second is this data that we have created helps us to map that in the entire city, so that people can take which are the hotspots, which are the non-hotspots, which are the green zones where they can navigate, which are the red zones where they cannot navigate. This information is already there, number one. Number two, whoever is a positive case, immediately in and around him, the message goes that, there is a positive case nearby. So that information is being used by the nearby people, so that they are alert and the infection spread does not happen. That is 2. And third, in fact, all the food distribution centers for the migrant laborers, in fact, 12 states and very, very senior officers from 12 states were asking about their laborers, about the laborers of their states. In fact, instead of answering every question, what we did that we plotted that in the map and we gave this map to them. We said, these are the food distribution centers, please know by yourself and please communicate it to your laborers also. So this made things seamless for feeding more than 1 million people. There was not even any problem from any states. In fact, this is something that was made a very, very nice arrangement through the COVID-19 application tracker. And there is a dashboard which is being used by media. In fact, sometimes media management is very, very critical. In fact, they keep on asking questions because in these critical times, we don't have time. And, this dashboard has helped us that real-time data is shared with media, and people don't really ask us now, what is the number, how many numbers are positive, negative, how many discharge, recovery rate, everything is given to them through this COVID-19 application tracker dashboard. In fact, this has helped us tremendously.
Commissioner Pani, can I ask you just a clarifying question? Through this dashboard, which sounds amazing, through this dashboard, are you offering real-time medical and hospital, medical infrastructure and hospital information as well, or is that through a different mechanism?
Yes, this is there. Medical information is completely there. In fact, all the acute respiratory infection people, their database is there. And there is a war room of intern doctors. And these doctors are monitoring their health every day. And if they find that there are symptoms regarding COVID, then immediately that person is asked to go to a sample collection center and the sample is collected and the treatment starts immediately. In fact, this is how this application has helped us. And in addition to that, we have mentioned the hospitals, the nearby CHCs or community health centers, the primary health centers, and the COVID hospitals which are there. This information is there on a real-time basis with the people. And this is being used by people very nicely.
Excellent, excellent. Thank you very much. And I would like to thank all of the panelists, the leaders from the respective Indian cities, sharing insights, sharing your strategies, and sharing your thoughts on where you go from here. Really appreciate the time, and it was some very thoughtful and helpful answers. What I'd like to do now is transition to the second panel. This second panel is going to be about 20 minutes. What it's going to include is 8-minute presentations from both of our panelists. And after each presentation, there's going to be about a 2-minute follow-up question from myself. And then there's going to be 10 minutes for not dissimilar sort of Q&A from the audience as well. So without further ado, because I want to make sure we're on time and we stay on time, I want to introduce the two panelists, Mr. Albert Graves, who's a program director, World Smart Sustainable Cities Organization from South Korea, and then from the United States, Ms. Beth Blower, executive director of the Centers for Civic Impact at Johns Hopkins University. We're excited to have them speak to the audience and engage based on a lot of the information and thoughtful concepts and strategies and ideas that we heard from the previous panel, but also share some best practices, lessons learned, and things that they've seen throughout, nationally throughout engaging with organizations, governments, and centers. And so with that, I'd like to hand it off to Albert Graves, who's going to share his screen and do an 8-minute presentation. Thank you for joining us.
Thank you very much. Just to clarify, will the presentation material be shown from the organizer's end?
I think are you able to share your screen?
I see. One moment. Let me then try to pull that up. While I'm talking, thank you very much, while I'm searching, thank you very much for inviting me. As the moderator introduced, I'm Albert, and I'm working with WeGo. In case you don't know what WeGo is, We are an international association for smart cities. We happen to be based in Seoul, Korea, and we have over 200 members around the world, including local governments, corporations, and institutions. And we serve as a matchmaker for these, for all of these stakeholders. We do things like training programs for government officials. We do things like feasibility studies and pilot projects and so on to support smart city development around the world. And I am still trying to find this file. It is important because it shows some of the cases that.
You know what, Albert? While you're looking for your file, maybe I can just ask Beth to also give some background on the Centers for Civic Impact and some of the work in general that they've been doing. Beth?
Perfect.
Sure. Hi, everyone. I'm Beth. Thanks so much for having me. I run the Centers for Civic Impact, where in my pre-COVID life, had been working with mayors and city managers across the globe, helping them build out data systems and understand how they can use data to align to outcomes. But in February, I think everyone's life, at least certainly here, has changed. And I started to turn my attention to tracking COVID-19 with my colleague, Lauren Gardner, in the School of Engineering here at Hopkins. Lauren, Dr. Gardner and her team started tracking the very early outbreak of COVID-19 in China and started creating a geospatial platform for tracking all that information. And should I just launch into my presentation? I'm ready to roll, and then we can switch back to Albert, or is Albert ready to go?
Are you ready, Albert, or you need some more time?
I have just pulled it up, and this is my first time using Zoom, believe it or not. So let me see if it works. I'm going to click share screen.
And then just select the PowerPoint that you want to share.
Do you see? Okay, so it's showing WeGo Smart Health Responder, yes?
Yeah, yes, thank you.
Okay, sorry for the delay, everyone. Obviously, even though we are an international association and represent stakeholders from around the world, one of the reasons I was invited here was because the organizers are quite interested in learning from the best practice of Korea, where we happen to be based with our secretariat. If you may know, South Korea has been lauded as one of the best examples of a success story in the face of COVID. Over the last week or so, we've kept our numbers of new cases at 10 or under. And today we've had 0 cases, actually, just several which were imported. So we pretty much have got it under control, and all the much so without a lockdown or anything like this, which is enforced by the government. But I'm going to talk a little bit about what Seoul has done in particular, because Seoul is our president's city, and we happen to have a lot of information from Seoul. But I just want to start with one of the new initiatives from my organization, which is called Smart Health Responder. Now, this is something that's available on our website. If you go there, you can see we have a repository of best practice cases from around the world, not just Seoul and Korea, but national and local government initiatives in the face of COVID. And you can see this online. We are doing in-house research on this. We're also making available a number of different videos and resources from our partner organizations on COVID-19 to help our stakeholders get to know some of the ways that they can battle the crisis where they are. And we will also be making webinars of our own. So I will talk about that a little bit later in case any of the audience would like to know more about maybe Korean cases or the cases of others within our network. Besides that, we also have what we call need assistance. If you click that, let me just go through it. This is the repository where you can see all of the different cases. As you can see, some of them are national, some of them are local, and some of them I will be talking about. But before that, this is what the page looks like for the videos and the webinars. So you can see that we are already featuring some from Korea as well as others. And then this is the need assistance page. Here we are collecting information from manufacturers in Korea of medical supplies. And I think there are many cities that are on this call, and we would be very much interested in getting to know those cities who need assistance in this area, whether they need PPEs, things like this. We are trying to connect with the Ministry of Foreign Affairs here in Korea, with whom we have a close relationship, and trying to get those supplies to those cities that need it. Let's just start with some of Seoul's measures and policies, because that is of much interest. If we look at figure 1, we can see what is called drive-through screening. This is something that actually started in Taiwan, but then was quickly also adopted in Korea. And within 10 minutes, you can drive your car up to the booth, and you can get a test. And then within 2 to 3 days later, you can get that test result sent to you via your phone. And since the beginning of this month, over 4,000 residents in Seoul have been tested through these screening stations. Out of that, 6 cases were confirmed. And these are cases that can be replicated in India, but obviously not everybody has a car, especially in very urban areas like New Delhi, where living spaces are crowded and it's not very affordable. So same in Seoul, there's no reason to have a car. So there are many residents that would not make use of this. So we also have walk-through testing booths. And this is particularly for the elderly and patients without cars, obviously. And this kind of testing can be safely done in a phone booth sized room. And there's complete separation between the patient and the medical staff. Because these are smaller, they also take up less space, and then they're easier to disinfect after the use of one person. So that takes even less time, and the whole process is faster. Besides this one, there's also a system whereby doctors can examine patients with this type of protective screen and gloves that allow them to examine the patients without having any risk to themselves. If you look at figure 2, obviously COVID has affected businesses, particularly those small and medium-sized enterprises. And this is something that's the reality around the world. And one of the campaigns that has been carried out by the city of Seoul is to use this clean zone sticker, which is used after the disinfections are performed around the city. So whenever there are multi-use facilities, for example, gyms and so on, and places that have been confirmed visited by patients who were later found out to have the virus. After these disinfections are made, these stickers are placed on those businesses so that it takes away the stigma and the fear by the general public of visiting those places. So when citizens can see this designation, then they have more peace of mind. And then if you look at the figure 3 on the bottom right, you can see, yes?
Two quick things. Can you hit full screen on your presentation, please? But then also, you have about 1.5 minutes left.
I think it is already on full screen.
It's already on full screen? Okay.
Sorry if you cannot see that, but
got about 1.5 or so minutes left. Thank you.
So social distancing is obviously something that is being practiced around the world. It's something that we see works. And in place of a lockdown, South Korea has been famous for its practice of social distancing, which is religiously followed by the public. There's masks are being worn by everyone voluntarily. There's gel everywhere, the sanitary gel that people use on buses and other places when they walk into the post office and so on. They voluntarily share their information when they're confirmed as infected. There are many other things I would like to go into, but because of the limitation of time, I won't do that so much. But I also want to say that WeGo has something called a smart city driver. And a lot of the solutions that we are seeing in Korea and in other cities around the world are solutions that are powered by smart tech. And even though even though not every city has access to the most expensive technical solutions, there are plenty of others that have a lot of promise, especially in this crisis. So I encourage people to look more into that. I won't talk too much about that. But I will say that just to close this part, that we will have a webinar series of our own on smart health. The first one is going to be on Friday, May 29th, 4 p.m. Korean Standard Time, and it's going to talk more about Korea's response. So if you're interested in these types of things, of course, you can shoot a question in the Q&A box here, and then I will respond to that if I can. But we're also going to go more into the smart tech solutions that have been used, and then we will also bring in professionals from the medical community to give some advice on readiness for the second wave, which we are all expecting to come later on in the year. So thank you very much for your attention.
Thank you. Thank you so much, Albert. With an interest of time, we're going to move to Beth. Let's see, Albert, can you stop sharing your screen? Let's see if I can. Okay, there we go. Perfect. Beth, feel free to share your screen and go
Great.
for it.
Yep. So I'm sharing now. Let me know if you can see it.
Yep, we can see it.
And if I do it in the slideshow mode, can you see it? Can you see the full screen now?
Yep, we can see full screen.
Okay.
Thank you.
Great. So, so this is probably, many of you may have already seen this version of the map. It's been sort of wildly used as the source of reference for a lot of the, especially early tracking of the COVID-19 outbreak. We've been working with the School of Engineering for quite some time on trying to figure out what is the most authoritative data and making sure that we are updating it in real time or near time. And so this started off when, again, we were just looking at the outbreak in China, and we've been pulling in additional data sources into the university to try to really frame the disease spread. I do a lot of work focused on US cities and sort of helping US cities prepare for decision-making and sort of the critical work that they have to do in order to manage. And when we started to look at the global map, we wanted to get a little bit more granular data. And I think in the earlier presentations, I heard that a lot of you are also using geospatial analysis to not only track the disease progression, but also all the services and the conditions in your local communities to make sure that you're aligning resources adequately and appropriately. And I wanted to be able to also do those things. So the team at the centers started working on a bit more of a granular view where we can see obviously the disease spread data, but we wanted to allow people to zoom in to a much more city-based focus. And so we started to create these dashboard views of the data, and we're trying to bring in more and more real-time data to give public sector leaders the opportunity to understand the impact that the disease is having on their particular communities, and encourage them to also start sharing more data around the local impact. So you can see here the data is divided in 3 categories. We're focused on health facts and infrastructure. I heard many of you talk about the fact that you are tracking your health infrastructure. We wanted to make sure that people in local communities understood what their local infrastructure looked like, how much capacity they had. We also, in the States, obviously focus a lot on access to healthcare because we have a very privatized system. So we're tracking essentially who has insurance and where that insurance comes from as we're looking at the twin economic crisis. A majority of Americans rely on employee subsidized healthcare, and when they lose their jobs, they also lose healthcare, and it's going to create an additional crisis. So compounding a lot of the complexities in communities. We're looking at the population demographics of our cities because we know that there are a lot of people who are poor and a lot of people that have pre-existing conditions where the disease is seeming to have a much more detrimental effect and the outcomes are much worse. And so we want to prime communities for tracking this information. And then for each one of our local communities, we're also looking at the case data against the state's data and also against some of the national infrastructure of data. we're looking at both the three sort of prime areas where we're tracking are cases, deaths, and testing, because we know that testing is really going to be the sort of next frontier for us to be able to contain and drive decision making. The other element we're tracking at a very local level are the policy decisions. So what are the stay-at-home policies in a particular jurisdiction at a particular time? In addition to looking at this data from these sort of hyper-local and sort of macro perspectives, we're also trying to do a little bit of data advocacy to try to encourage states to share more data so we can get a better picture of the impact that the disease is having. So this is a slide that's also, you can access this resource publicly in the COVID resources at JHU. But essentially what this does is we know that in particular, our Black communities in the country are disproportionately being affected by the disease. They're dying at higher rates, they're confirmed at higher rates. And so we wanna make sure, number one, at a very threshold level, that all the local jurisdictions are sharing data so we understand this disproportionality and the impact it's having as we're creating public health messaging, as we're thinking about what interventions look like. And so you can see, while for our confirmed cases, we have a lot of states that are sharing this data, our death data is less consistent, and then having testing data broken down by race seems to be one of the biggest challenges. But we're really trying to encourage local leaders to start thinking about this data first so they can identify these vulnerable populations and really attach some of the public health messaging to those that are going to be most disproportionately impacted by disease. All of these resources are updated daily. So as new data comes in, all of these are live resources. You can see other analysis that we're doing both from a domestic and a global perspective in this critical trend section of the site, where we're looking at the countries and the states that are moving through at different time arcs, the disease progression, but also trying to look at what are some of the regressionary effects or some of the effects that are happening from an economic perspective that are also playing out in these local communities. In the presentations from the local leaders, which I found to be really fascinating, I apologize, I was a bit late, so I didn't get to hear the start. I was really interested in also some of the other sort of informal systems that you are tracking to see whether or not your interventions are having an impact. We're also really keenly looking at these informal systems, whether they're mutual aid agreements that are being created at the community level, or they are community-led feeding programs, or these are these sort of very local actions that are also being tracked that I think are going to be really a defining moment for how we've responded to COVID-19. I also think that it is critically important for us to think about this public data moment. Data has played an incredibly important role. For the first time, I think many individuals are understanding why it's so important to have trusted and valuable public data. Because not only are we making decisions for our communities, but people that are living in our communities are deciding whether they go into the green zones or the red zones. They're making decisions around how they're commuting, how they're interacting with each other based on these publicly available data sets. And so some of the best practices that we're seeing are intergovernmental data sharing agreements that are being articulated as a way to not only reflect the data landscape that has allowed us to share a lot of this information with the public, but also has been able to drive a lot of the future sort of sustainable thinking around these practices. The other things that we're trying to do from a data perspective is bring in more of the contextualizing data. So whether that's the economic data, whether we're tracking the particulate matter, we know that this is a respiratory infection, and if there's high levels of particulate matter in the air, we can pull that down from our censoring and overlay that with the disease progression to see if whether or not that's exacerbating outcomes. So how can we integrate a lot of these sort of data elements that we know we've been sort of gearing up for as we think about smart cities, but how are we intersecting them with emergency response and letting it frame how we're making decisions and how we're targeting resources. And so these are the areas that we're exploring through the work that we're doing at Johns Hopkins University. And it's really focused on how we can take already publicly available data and overlay it as we are monitoring the progression of the disease. So I'm going to leave it there and open it up. I know we're going to hopefully have some time for questions, but again, thank you so much for your contributions to the panel. I really did enjoy hearing about what's happening at the local level, and I'm hoping that we can continue to have this conversation.
Thank you very much. In the interest of time, I want to just, you know, specifically just kind of go to Kunal Kumar and ask a quick question. And I really appreciate Beth and Albert's insight. And I think that they absolutely shared some best practices and some thoughts that India and the cities in India can actually take advantage of. And we'll encourage more engagement and collaboration. What I'd like to do for close in the interest of time is to just go straight to Kunal Kumar and ask you for some takeaways, but then also specifically structure the question, how can the Ministry of Housing and Urban Affairs, and especially the smart cities mission that you drive, facilitate urban governments to be agile and drive community action?
Thank you, Dr. Aman. How much time do I have?
I'd say about 5 minutes, three to five, so 4.
Okay, I'll take 4. I'll take 4.5 if you permit. You know, it's been a fascinating learning for me, listening to Albert, Beth, and all my Indian colleagues. I think we've been talking on India, so let's focus on India. I think the Prime Minister in our country has led the battle from the front. We've seen very, very proactive steps taken right from the beginning. One of the things that's really come out and people have been talking about is the role that the smart cities have played. And everyone understands that they have differentiated and they have acted as lighthouses. And of course, partnerships like WEF and the collaborations that have been built by us have really been useful in getting new ideas into the system. I think 10 fundamental questions, which I would probably, because you know, in a sense, I'm trying to conclude this discussion. I feel they've come out of this this whole deliberation that we've had. I think one is, of course, the deep roots of globalization that we see. You know, the viruses, supply chains, and all the opportunities and threats that we have today in our cities. They don't see boundaries, and they don't see national boundaries. It's all a connected world where, you know, you are living in a global village, and therefore our cities, the sooner they realize the, you know, you've been talking about globalization, but I don't think there could be a better example of understanding how global issues touch you than the virus that has really struck us all globally. I think the second thing that really comes out from this discussion is about evolving a kind of socio-economic consciousness in society. What's it that you want as a normal? Do you ever think about dignity for a laborer? You know, do a person who comes as a migrant into your city? What do you think about competitiveness? Does competitiveness mean to you that you know, create the sweatshops that you see in some parts of the world? Or does it mean much more than that? So cities, when they build the new normal, have to decide on this question of what is the social consciousness that you want to see going ahead. I think the third big issue that comes out is missing markets. So there are no markets for migrant labor, good quality health, education, online schooling, and things like that at the bottom of the pyramid. How do you develop those missing markets? And government's role, a lot of times, is talked about only to fill the gaps which markets can't do. But even if that's the case, but these are clear markets that government have to build. And this is a time that we need consciously to go into that. Of course, the fourth important thing which has come out is the role of technology. And I think most speakers talked about, and Beth's presentation also showed how technology was getting used. I think there's a lot of issue about trust in technology also, and probably the new normal, there'll be a lot of question about surveillance and trust, but it's much beyond that. And I think cities have to build the right approach towards technology going forward and try to use technology. You know, technology is like a tiger. The moment you slip from the back of the tiger, the technology is supreme. So you actually have to use it very consciously. Then, of course, it's about resilience. And cities have to now start looking at resilience more into urban planning. I think, you know, we don't plan for black swan events. We don't think about insurance till something happens to someone we know. You know, that's normal human tendency. So we don't plan for black swan events because most of our funds and resources are planned for what is to be done today or maybe yesterday or maybe tomorrow. We don't think of situations which lie ahead of us. So that's one. The sixth thing is about the safety nets for the vulnerable. We have to stop back. We have to, think about what we have created in society. How every one of us is connected. It's not about the global cities getting connected. It's about every person in the city being connected to each other. Each other's life is equally important to us. And therefore, how do you manage slums, hygiene, education, sanitation, jobs? Those are very, very important questions that we need to answer, especially for the vulnerable people. Then data, of course, is another issue that has been, highlighted. And the role data has played and would have played. I mean, we heard from Shada ma'am and we heard from Mati sir about how having data could have helped, or how data being there was so helpful. And how data is essentially helping us in 4 ways: collecting information, managing the scenario, doing right communication, and also predicting what's going to happen in the future. So important role for data in the future. Of course, building health and education infrastructure. And those are the missing markets I was talking about, which are so very crucial. These are not economic growth fundamentals. These are basic human needs. And it's time that cities, states, and countries spend upon health and education, thinking of them as basic human needs. That's given that we have to spend on that. There's no question. There's no ifs and buts. This is not the other infrastructure. This is infrastructure has to be given. Then, of course, a lot of talk about decentralization. I think fundamental question and the fundamental answer that this COVID crisis has given us is how decentralization works. In a normal situation, I'm not talking of other countries, a country like India, the federal structure has a lot of constraints at the local level. But when you have a crisis, it almost gets dissipated overnight because you have to deal with the crisis. The soldier at the front can't look at an order from the general who's sitting 1,000 kilometers away in the time of crisis. Now, if cities can be so innovative in crisis, can that become the new normal? How can we look at making our governance systems more flexible? And the last one, I think, is about flexibility in governance systems. I think speaker from Kerala talked about it, how flexibility, the role for even giving this opportunity to make bona fide mistakes. And this trust in society, look, public managers are not superhuman. They will make mistakes. You have to give them that space. Only then innovativeness and new approaches will come in the system. So these are fundamental questions that come out. Now, coming to what smart cities will do, I think we're collecting all this. We are seized with these issues. We are looking at being agile with how we develop cities in the future. We're looking at adapting to this new scenarios and the new learnings that have come in. And believe it or not, we actually will now change course. We were thinking of newer strategies and how we will evolve in our smart cities mission going forward. We're learning from states, we're learning from cities, we're learning from frontline workers. And I think we're learning from all health professionals, everyone. Salute to the entire community which has worked with us. And India really has, risen to the crisis, and everyone is contributing. And there's a lot of learning through each life that we see around us. So, the best thing that our mission can do is to absorb all that and make it reflect in our new ways going forward. So I'll stop there. Maybe I don't know how much time I took. Yeah.
It doesn't matter. Those were great closing remarks. This was an extremely productive, thoughtful, and useful conversation. And I was proud to be a part of it and had a front row seat. And thank you, everyone, to the participants of the panel, the experts and the leaders. And thank you for the participants for being a part and sharing your questions. This was a great experience and great panel. And I think we've all learned a lot here.
Thank you.
Thank you.
Thank you, everyone.
Thank you. Bye, everyone. Thank you.
Bye.
Thank you.
Hi, Albert. How are you?
Great to see you.
Yeah.
I tried to use that background on this. As I told you, this is my first time using this. And
Okay.
half of me started to disappear. So clearly it didn't really work.
Yeah, I think technology is sometimes new. So I hope you're doing fine in Seoul.
Yes, everything's fine. We did a month or so of remote work and then back to the office now. But we're all being very careful. You're also in remote work, right?
You look like a zombie, isn't it?
Not really. Actually, some of us, around 33% of the office staff are required to attend office. So
Ah, I
some of
see.
us, yeah, but we maintain our distance and follow all protocols like sanitization.
Mm-mm. Well, I hope to see you again soon, whether it's, you know, in India or Korea or wherever else. We were
Yeah.
hoping to see you, maybe like to invite you to our General Assembly later this year in Makati in the Philippines, but it was just in the last few days canceled.
So,
I mean, everything's being canceled, so I don't know what to do.
I know this year is going to be different, I guess. So,
Yes.
but anyway, great to see you. I thought I'll just take this opportunity to say hi, and that was
Yes.
good that you made.
Thank you very much. Next time I'll be more prepared with the technical, you know,
It must be very late for you.
side of
I
it.
think must be midnight or past midnight.
Yes, just past midnight, so about time
Okay.
to go to bed.
Yeah. Okay, so good night.
Yes, have a good rest of the day.
Yeah, thank you. And
Bye-bye.
yeah, thank you, Puneet. Thank you, Jinal, and thank you, Shubhanki, for everything. Okay, let's say good night. Bye.